John Popovich here again in front of the living wall, continue our Legends series. You had heard in one of our previous episodes the magnet journey that our nursing staff and institution is moving toward. And we have two people that exemplify exactly those characteristics with Cathy Jackman as well as Talley, both clinical nurse specialists. Let me ask you a real simple question. What is a clinical nurse specialist, and how is it different than other nursing activities on the floor?
Well, let me go first. Our role really is multifaceted, and it's about building the structure and a supportive environment for nurses to do the best work that they can. So whether it's providing policies that are evidence-based or looking at clinical outcomes of our patients and trying to do process improvement and provide the nurses what they need to do for excellent care.
Jean?
With clinical nurse specialists, we always look at someone who is the leader, someone who's providing direction for nurses, and that's what we look at. We look at research, trying to provide the best for them so they understand why they do certain things. They understand why we develop protocols, why we have guidelines, why there is practice. And this is something that we focus on, because we're the leaders in this area. We have the expertise in this area. So we want to build so Henry Ford will be one of the leaders also.
Tell me about the education and training that you go through to become a clinical nurse specialist.
To me, I started here with an associate's degree. It was 30 years ago. And becoming an associate degree nurse, I wanted to find other avenues or areas that I could help the nurses that I work with. So I went back for a BSN degree, and then for a master's. It was a total of 8 more years of school. So it was where I had to focus on, did I want to go into education or did I want to go into the medical realm of it? I wanted to be someone who could provide education to nurses so that I can tell them that your role is important in everyday life and everyday nursing, because you're the one who is going to provide the care for the patient. You're going to look at the policy. You're going to look at practice. You're going to be the one that uses the research to say what is best.
Sometimes it's confusing about the difference between a nurse practitioner and a clinical nurse specialist. What are the differences, Cathy?
The nurse practitioner is more in a medical model where they're diagnosis and treatment for patients. The clinical nurse specialist is looking at more at the nursing care provided for the patient. And we look at the evidence-based practice as well relating to medicine and try and integrate both of those so that the patient gets the best care.
What does the magnet journey mean to both of you?
For me, I think it continues just to support the environment that nursing's practice in the best way possible. So as we're headed on this journey, we've looked at the best way to provide the nurses more education, getting their certifications and supporting them in a lot of those endeavors.
It's a start for us, but it also says that we're providing the best care that anyone can provide. That our nurses, under the leadership of the clinical nurse specialists, we make sure that our nurses are doing the best, that we bring the best to the table, that we pick the best people. We provide the best education so our nurses can shine, so it will be where they can go anywhere, be known as someone who came from Henry Ford, and that they learn the best and provide the best.
Well, we're extraordinarily proud of nursing staff here at Henry Ford. Nothing that is done here could be accomplished in terms of patient care or really the institution moving forward at all without having incredible nursing staff. And it's really a pleasure to have both of you are really examples of the pinnacle of what nursing represents here at Henry Ford. So I want to thank both of you for meeting with us.
Thank you, Dr. Popovich.
You're welcome. Thanks.
Thank you so much.
Welcome.